So hello and welcome everyone. My name is Marilyn Devonish. I've met many of you before. We're here with the wonderful Deanna Hansen, who is the creator of Something Incredible. And the reason we're both here is because of Dr. Margo, who I hope is now on the call, who badgered me into taking a look at this. Last week, my schedule was just, it was election time. I had no time, but Dr. Margo insisted that I meet with Deanna and have a Zoom call. What she showed me was absolutely amazing. Deanna, I have to be honest, those before and after pictures almost look a little bit too good to be true. And so I was really excited, and I just wanted all of you to be able to see this as well, so that you have the opportunity to share in that. So before I hand over to Deanna, Dr. Margo, are you here, and is there anything you wanted to share before we get started?
Hi, I don't think I'm muted, am I? Can you guys hear me?
Yes, we can hear you.
Hi there. Hi, I'm still trying to write to my guys that I invited because I sent them all individual invitations, but yeah.
Thanks. So do you want to say anything about this before we get started, or should we leave?
No, I think you should just start. Yeah, and we can talk later. Thanks.
Perfect. Wonderful. Well, Deanna, I'm going to hand it over to you in terms of, I haven't even told people what this is called, so they have no idea why they're here at all. All they know is about chronic pain management, potentially weight management, looking at cellulite, releasing old trauma, working with fascia, but they have no idea why they're here. So I'm going to hand it over to you to tell us about this wonderful thing called block therapy.
Oh, well, thank you so much for the introduction. And I'm truly excited to be sharing this with everybody. It's my passion, it's my purpose, and it works, which is just really exciting. So I just want to share a little bit about myself, how I came upon this process so that there's a really good basis of understanding. I became an athletic therapist in 1995, and I was always focusing on deep tissue work, and I had very strong hands and I was very good at my job. So I had a really great client base. However, my own personal life was, I was struggling. I was struggling with my size and shape. I was 50 pounds overweight. I had anxiety, depression, chronic pain. And the harder that I worked, the worse I became with my health, with my whole body. So I made some big changes at the age of 30 that were positive changes, but that resulted in a series of serious anxiety attacks. And this one anxiety attack in particular was the seed of everything to come. In the moment, I actually didn't think I was going to live because I was literally frozen in fear. I couldn't catch my breath. For some reason, I dove my hand into my abdomen. And the first thing I encountered was pain, but the pain brought me out of my anxiety attack. And then I started to explore with my hand in a very intuitive way in my abdomen. And what I also recognized that it was marbled with what felt like scar tissue. And again, I was very good at dealing with scar tissue, but on other people's bodies and their backs and legs, wherever people typically had pain. But to experience this in my own abdomen when I hadn't had any injury or surgery in that area, it really gave me a lot of aha moments for me that, sorry, people are still coming in. So I'm just dealing with this here on this end. It really gave me a lot of insights as to why I was struggling with my size and shape, because I would come back from a 5-mile run dripping wet with sweat and my belly would still feel cold. So suddenly I was realizing, no wonder nothing's changing on my body when I'm exercising. There's no blood flow getting to this tissue to metabolize it. And also recently I had started the practice of yoga, and I had a really great yoga teacher who probably every 30 seconds would remind us to breathe. And I recognized every time she reminded us to breathe, I wasn't breathing. So I thought, if this is me, this is probably the majority of people as well. So suddenly, like, everything was starting to come together. So that first night I was working, I was feeling really calm, which was not my normal state. So I did this for about 35 to 40 minutes, woke up the next day a little tender, but really felt calm all day and was excited to get back home that night and continue the exploration. After the second night of another 35, 45 minutes, when I stood up, I felt taller. And I went and I looked at myself in the mirror and I literally began to cry because my belly was flatter than it had looked in years of doing incredibly arduous work, Taebo, aerobics, weights, 400 sit-ups a day. I was doing all of these things to really try to change my body, and it was changing, but not for the better. I was actually getting worse. I was accumulating more compression. I was getting denser and thicker, more pain, and so on and so on. So this became my new process that I would do every single night when I came home from work. And after about 2 weeks, what was so amazing was, sorry, I'm just muting somebody there. After 2 weeks, what was amazing was my chronic pain was going away. And I really recognized the depression was starting to lift. And I was actually feeling really hopeful about life for the first time in a long time. So I started flipping my patients onto their backs and working in their abdomen in a similar way. And then I started having some amazing healings happen. And it became through a process. It wasn't just the abdomen, it became a full body exploration, which I also applied to my patients. And then a couple of years in, I had a patient say, you need to be teaching this. And I thought, I'm just kind of going with the flow in the tissue. I don't even really know what I'm doing, but I'm getting these amazing results with myself and my clients. So I started to pay attention. And what I recognized was that my hands were intuitively following the Fibonacci sequence. Now, the Fibonacci sequence is the sequence of numbers that is really the architecture of everything in nature. This is the Fibonacci sequence, the spiral of the galaxies, the nautilus seashells, how flowers form, how the bodies form, and even how the body ages. So I was really recognizing that I was tapping into the seams of time and unzipping them, which promoted blood and oxygen flow to cells previously blocked. And there was a rejuvenation process going on with this. So that really excited me because now I was really able to start to put a language to what I was doing and developing. So for the next number of years, I started teaching therapists to work on patients, but my real passion was to teach self-care. So I initially tried teaching people to use their hands, but there's a lot of limiting factors to that. So in about 2010, this was such a neat moment for me. I was pretty exhausted by that time because I was seeing 8 to 10 patients a day, an hour each, and then I'd come home and I would work for hours on my own body. So my hands were tired, I was tired. And every week I was having a restorative yoga class. So my yoga teacher was putting me into a sideline twist over a bolster. And she cautioned me that that's a very deep posture, so to be careful. And I thought, I don't even feel it. Like I'm so used to 10 years, like diving my hands deep in my tissue that I didn't even sense the pressure. And I had a wooden Iyengar yoga block from my days of Iyengar yoga nearby. And I said, I want to lie on that. And she's like, oh my gosh, you're crazy. So anyways, I grab it and I go into that sideline twist. And as soon as I did, I was so excited because I thought, oh my gosh, I don't need to use my hands and all of this energy this way. I can lie on this and using my body weight and gravity move into the pain in a very similar fashion. But the challenge was it had sharp edges, so it wasn't overly comfortable. So for the next 2 years, one of my body workers, who was also a woodworker, we spent time figuring out what the right size and shape for this tool would be, and ultimately came up with the Block Buddy and the Block Baby. So initially they were made of cedar, but now they're made of bamboo. And the reason that we've chosen this material is because it's similar in density to bone. So there's a reason that this is really important. What I'm dealing with is the fascia system. And I'm just going to explain a little bit about fascia because it's really integral to understanding how it really impacts absolutely everything from how we look, how we function, how we feel, even how we hold trauma and negative emotion inside the body. So this is my interpretation of fascia from my years of personal exploration. It's basically the cell membrane of every cell connected to every other cell. So it's like the matrix. And everything is absolutely interconnected. So the fascia is here to support and protect us. Now we have trillions of cells in the body, and each cell has a specific alignment. And as long as it's where it's supposed to be positioned, it has optimal space. And what's important to understand about space is when there's space, there's optimal flow. As soon as we take away space or we become congested, now we don't have our systems flowing optimally. And we are aging in a forward rotational direction because gravity is this constant force pulling us down. And we're dominant on one side. So we don't just compress linearly. We wind down one way or another, depending on how we use our bodies over time. So for example, I'm right-handed and I used to always spend all my time on my left foot. So fascia in its supportive way will grip and adhere to bone to help us keep upright. But these grips grip to bone with a force up to 2,000 pounds per square inch. It's a magnetic seal. But think about that internal pressure. So for example, if we've been sitting in front of a computer slumped over for 20, 30 years, 8 hours a day, we are literally sealed in that negative alignment. And this impacts how everything moves through the body. So I just want to talk a little bit about the 3 pillars of block therapy and why there's 3 parts to it and why this makes this system so impactful and simple to do. So the very first pillar is creating the space that we've lost over time. There's a time-space continuum. Typically, as we become older or go through time, we become shorter and wider. We decrease in our internal space. And then these adhesions develop in the fascia again to attempt to keep us upright. So when we lie on the tool, and we do so in each position throughout the body for a minimum of 3 minutes, pressure over time creates heat on the surface to create a melting of these adhesions. And then we combine that with the second pillar, which is proper diaphragmatic breathing. And this is really important. I'm just going to bring my camera down so you can see a little bit here. So right at the base of the rib cage is the muscle, the diaphragm. When it's functioning properly, it moves up and down in the body like a pump 24/7. When we inhale, it moves down. When we exhale, it comes up. And when we're breathing properly, all of the organs in through here, the heart and the lungs, everything gets this internal massage. The problem is pain, fear, and stress cause us to reactively hold the breath. So when this becomes our habit over time, this muscle becomes weak and then we fall in. And then as we fall in, the belly displaces outward, the organs get squished and pushed around. And now we don't have this pump working because we're literally breathing up through here. So now this area of the body becomes frozen. So for example, if I'm eating and my body's working really efficiently, the stomach organ, which is situated right here, part of the process of digestion is through the action of using this muscle to help digest our food. If I'm right-handed, which I am, and typically people collapse the opposite to the dominant side, then I'm compressing everything through here. So there's no action happening through here. So now we have a cold organ that's missing a component of digestion, not to mention the aorta, the main artery leaving the heart, comes right through here. So when we fall in and collapse, we're literally squeezing that artery. And so now the heart has to pump harder to get blood sent to all of the cells in the body. So right off the hop, now our whole system isn't working properly. And then we've got the liver on the other side, and fatty liver disease is on the rise. And if you think about butter at room temperature, it's a solid. When you heat it, it's a liquid. So we want to make sure that our body is properly heated. And when we breathe diaphragmatically, we feed the body up to 6 times the oxygen. Now, this is a real game changer when we can understand this, because if we are starved for oxygen for 5 minutes, the brain will die. And basically every cell in the body is a mini brain, essentially, or a mini body. So when we're not breathing properly, slowly over time, the cells become starved from oxygen. And the energy booster in the cell, the ATP, it requires oxygen to create energy in that cell. So this is why we see people going through this aging process that we assume is normal, because over time we start compressing, and then the breath eventually moves up to the upper chest, and we start to minimize the amount of oxygen absorption. And the reason it makes this difference 6 times, which is quite a difference in the amount, at the base of the lungs is where the alveoli, the majority of them reside. They're the oxygen receptor sites. So if we're breathing up through here, we're not pulling the air deeply enough into the lungs for optimal absorption. Not to mention, in 2014 in Australia, they did a study proving that 84% of weight loss comes through proper exhalation, which takes me back to in my 20s when I was literally starving myself at times and working out like a fiend, and I was getting bigger. I wasn't breathing. I was frozen in my body, so there was nothing happening as far as metabolism. So that's the second pillar, is making sure people really understand proper diaphragmatic breathing and how to train that properly. And it's phenomenal because it's fast. The very first class that we do in the starter program is teaching people how to release that diaphragm, because essentially it's like a frozen shoulder. When we collapse in, this plate of muscle, it folds in on itself. So even if you're doing breathing exercises, you're not getting enough. So through the process of releasing those adhesions, we are able to activate this full muscle and start feeding all the cells in the body proper amounts of oxygen. And if you think of a balloon, if you blow up a balloon fully, it almost defies gravity. It's smooth, it glows, it's buoyant and light. Take half of the air out of the balloon and it becomes dense and heavy and wrinkled, and it accumulates dust. And that's kind of what happens to the cells as we age, but we don't have to allow that. And even better, we can reverse what's happened up until this point. So that's the really exciting piece, is you really have, you know, so much of the control of your health in your own hands. And then the third pillar is understanding proper postural foundations, because we don't want to just fall back into the posture that really created this negative scenario in our body. We want to support how to sit, how to stand, even the tongue muscle. People don't realize that the tongue isn't just used for talking and chewing. It's also designed to support the weight of the head. So we have strengthening exercises to really bring the tongue into action. And people that have a double chin, it's not a double chin, it's actually a displaced tongue. So all of these things work together, and we've created a really simple process so people can just follow along, get the results. And we have a community on Facebook, Block Therapy members of almost 7,000 people now, sharing every single day the changes that they're having, and they're amazing. Like it's probably one of the best things that I've ever done, is create this community, because I have people with fibromyalgia that are blocking, and then they'll share with others coming in, oh, I have fibromyalgia, does block therapy work? So it's not just me saying this works because of this, it's people in the community that have whatever conditions they are that are also there supporting others coming in through the process.
Awesome, Deanna. Thank you so much for that. Can you guys all hear me? Yeah.
Yes.
I was, interestingly, I was looking at my posture while you were talking, thinking I'm over to the left and I'm left-handed. And so guys, I don't know all of you on the call, but thanks a million for all coming on. I found out about Deanna Deanna, it must have been March when you did the digital healing seminar. And I heard you for the first time, and I was really struck by your enthusiasm and your passion for what you're doing. And as an immunologist, as a scientist, and an advanced nurse practitioner, I was really, it made a lot of sense to me. It made a lot of sense scientifically. It made a lot of sense. And at the time, I didn't even realize that it was spiritual as well, which is right up my street, and Marilyn's as well. And so I ordered the blocks straight after I first heard you talk. And I got them in Scotland, and I've been working with them ever since. So I'm slightly further ahead from Marilyn, but I knew that I had to tell Marilyn all about this. And then I just to give Deanna a lot of thanks, because the second day that I tried the starter program, which is 9 days, and it helps you to go through each body part in a sequential manner, so that you learn how to use the blocks, you learn how to breathe, you learn how to get your diaphragm moving. And it starts at 15 minutes and then 30, and it goes up to 60 or 90. It was really, really great. But after the second day, I had something called a rib release, where I actually had a pain in my ribs, and Deanna had explained it, where if you've been bent over for so long over your computer and not having good posture, your ribs actually get kind of stuck together, which, you know, is amazing, but true. And they ping open when you start to lean on the blocks and breathe properly. So I had a bit of pain, and Deanna had said, please get in touch. And she'd actually given her private email. And so I wrote to her, and she was immediately like, let me help you. Can you send me a photo? And I thought, how's she going to detect anything from a photograph of my ribs? But I didn't get around to doing that, because I didn't have anyone to take a photo of me. And a selfie was too tricky for me. So anyway, the next day I got another email from you, Deanna, and you said to me, look, if it's a problem, you know, we can meet on Zoom. And I was really blown away by the customer service, and the fact that it was you, you know, personally, that was really interested in just another of your clients. So that really, really, really impressed me. And so Deanna then offered to help coach me for a month, and immediately told me that she had to look at my calves. And I thought, how can that relate to my ribs? But it did. And, you know, it's really, I mean, guys, if you haven't read about it, everything's interconnected. So my calves had seized up over the years with just lack of proper posture and walking and everything, and that had affected my rib cage. And just after 1 or 2 days, that pain went away. So thank you so much for that. It's really great.
Oh, my pleasure.
Yeah. And the other thing I wanted to tell you, Deanna, that I knew, but I had forgotten to say to you when you started teaching people about using their tongue and putting their tongue in the right position, because it's a very powerful muscle. As a Qigong healer and teacher, we say to people at the very beginning, could you put your tongue on the roof of your mouth? And it's literally exactly what you're telling people to do in order to align yourself better and take some weight off your neck and your head. And the reason that we say that is because it connects your central front energy channel with your governing back energy channel. So it basically allows the energy in your system to be totally connected. So all the things that you have said, they link in so much with a lot of the things that I'm doing, but I definitely have seen a huge difference in I'm much more conscious of my posture now. I'm much more conscious of my walking, my standing, my sitting. So, it really does work, and I'm just delighted that we found you. So thank you very much.
Oh, thanks, Margo. I'm just so happy that we connected as well. And it is one of my passions. I'm very much with the community. I always want to ensure if people are struggling, I'm there, because that's what this is all about. And this is my purpose and mission, is to help people get out of pain and to also find their intuitive gifts. And that's the whole spirituality side of things. But it really does come through this practice. And whenever you're ready to dive into that, I'm happy to talk about that side of things as well.
Brilliant. Thank you.
Wonderful. And I think if I didn't already have my block, which is just here beside me, and just absolutely gorgeous. If I didn't have my block, I'd be sitting here thinking, okay, all sounds great. How do I get started? And I'd said to people that there's room for a rolled up towel. And I saw in one of the videos, you had one of Greg Braden. I love Greg Braden. He's fabulous. You had one of Greg Braden's books. So please feel free to dive in, tell people a little bit more about where they can maybe start if they wanted to put some of what you're talking about into practice, and maybe give us a few examples of things that people could start doing right away to get the energy moving and start unsticking and unblocking things.
Well, and we have a gift here for everybody, a free gift. It's 9 videos. Each is about 8 to 15 minutes long, using a rolled up towel. And it's actually pretty amazing. The rolled up towel does a good job at decompressing fascia. It's not the same as the tool, but it certainly gives you the understanding of what's going on in the body. And we always start, no matter what class I'm doing, I always start first lying on the belly. So whether it's a rolled up towel or a block, we lie on the belly and we're lying flat. And we teach people to inhale into the tool. And really, you can even just inhale into the floor. It's important because most people that have been breathing up fear for a very long time, it's not like you can just turn on the diaphragmatic breath. It's a habit. And we have to retrain how this muscle works. It's also about releasing those adhesions in the rib cage so that we can actually create more of that muscle to be used, as I mentioned before. So we work all through the rib cage. And I'm not sure if you're wanting me on the floor doing this, or if you're just wanting me to share, because people can get that free gift right away and start accessing this. But like starting through here, we again talked about the stomach organ, the aorta. So we lie on the block this way, and you can do all the work on a bed, which is less intense than the floor. And we take 3 minutes and you literally search for pain. You do it on the side ribs, because again, as these ribs get really dense and compressed and frozen, it creates a heaviness of the rib cage, the head, the arms, pushing into that core space, and it displaces the organs. It slows the flow. And it's funny because, well, it's not funny, it's interesting because, as people get older, they tend to feel like even if they haven't changed their diet or their exercise routine, they often find that it's harder to keep the same size and shape, because it's not about fat, it's about displaced fascia from compression. So as we continue to fall into the spaces in the body, whether it's your hip joint that you fall into because you shift off balance, and then we have maybe what would look like saddlebags, or again, that belly, or the spare tire, it's all because of compression and ballooning. When we become shorter, we become wider. So as we release the adhesions holding us in these spaces, we then become taller. And that's one of the things people always report is, oh my gosh, I just did a class, I got into my car and I had to adjust my mirror. Or people actually observe that, they gain their height back. So all of these different things happen through the process. But I would really just encourage everyone to dive into that free gift, because you can get it immediately. You can start right away with that rolled up towel. Each position we hold for 3 minutes. And the reason is because we can't rush melting. So just imagine if you had an ice block here and you put your hands on it. If you rubbed your hands really fast on the ice block, you would burn your hands. If you let your hands settle and you let the heat of your hands connect to the ice, eventually you start to go with the flow of how that ice is melting. And that's how we teach people to melt through the layer of fascia. So you use your pain as your guide, because pain is really what took us away from correct alignment. So now you have this roadmap back to correct alignment. And the lovely thing is first of all, you're in total control of the amount of pain, because you're lying on the tool and you can prop yourself up again. You can do it on a bed. But the rule is your breath is your guide. As long as you're breathing in a relaxed way, you will be feeding and healing your cells. If any position hurts so much it takes that relaxed breath away, that's your body saying this is too intense and we need to back off. So we give variations in the classes and different things that you can do if it is too intense. But again, it's that minimum of 3 minutes. So everything is super slow moving and there's nothing jarring to the body, which is lovely, because again, for people with fibromyalgia that may not even be able to get out of bed, you can still access this work. And once you start increasing the amount of oxygen in the body and detoxing through that breathing, very quickly things begin to change and flow resumes and pain changes, as well as so many other things. So Marilyn, were you wanting me to like move my computer and get on a floor and do something, or is this sort of what you were looking for?
Absolutely. So I'm gonna leave that in your hands. Now, for those of you who are watching, would you like Deanna to demonstrate something for you? Give us a thumbs up, put a yes in the chat. So okay. Treena's got a thumbs up, Lynn's got a thumbs up. Not everyone's got their camera on, but it might be nice just so we can, because when I watched your videos, like, it all makes sense now. The videos are amazing and very instructional and very clear. So it might be lovely if you want to do a quick demo of something. That would be amazing.
Okay, so I'm going to take my headsets out so the not be as good. You can all hear me though?
Yeah.
Yeah, we can still hear you.
Perfect. So mind my messy apartment. I think this will probably give us the best sunlight here. Okay, so the very first position that we always teach is the belly. And if for some reason you can't do this comfortably, we have variations for that as well. But I'm placing the block directly on top of my belly button. And then for 3 minutes, we go through instructions. So for the first minute, we really use the prop as the understanding of where to breathe into. So we instruct you to inhale into the block. Because again, most people are used to breathing up through here, and we really want to bring the breath down so we pull the oxygen deeply enough into the lungs. So for 3 minutes, we're basically sitting here breathing. And then as we start to get used to the pressure, you can actually search for the pain, because the pressure fibers are larger in diameter than the pain fibers. So within about a minute, the pain that you experience becomes almost nullified. And then you want to dive deeper and you want to search for more pain. But again, it's pain that you're in control of. So it's very different than pain that comes through injury. So this is one example. The side ribs. This is really important because again, think of what's going on in the rib cage, the heart and the lungs. The heart is obviously the most important organ when it comes to life. And what makes the rib cage so powerful is the flexibility. It's the space between the ribs. And as Margo was saying, as we compress over time, the ribs fuse together, or not fuse, they freeze together. And then we have this hard container, and that adds a lot of weight and heaviness to the core of the body, and then we collapse inward. So even just lying here and very slowly searching for that pain as you breathe, you start to melt through those adhesions. Another example is right in the shoulder. For people that have any issues with range of motion of their shoulder, we look for the pain, you lean forward, you look for it. We can slowly move. We also add isometrics into our more advanced classes so we can strengthen the body back in correct alignment. For people that have had, say, a C-section, working through the pelvis, we can have the block a little bit higher and we can go right above the pubic bone, right onto that C-section scar. And over time, this is going to melt through that scar and really create integration of the tissue that basically we've lost from scarring, wherever it is. We can get into the legs and we can do the IT band, for example. And again, lots of people do the rollers, but when you're rolling, you're really connecting to the surface layers. When we sink for 3 minutes and we slowly search for pain, again, we're getting to those adhesions that have gripped to bone. And for something like cellulite, this is why it's so important, because when we tip off balance, again, the fascia is going to grip to bone in a spiral fashion, creating the appearance of the dimples. But more importantly, it's also blocking blood and oxygen flow to cells on the other side of those adhesions. So to be on there and to search for the pain and to pump that oxygen in through proper breathing, we release the tissue from the bone. We change the surface appearance of the tissue, as well as how that tissue responds all the way to the root of the problem, so we can open up the flow. We do head to toe work. I also, in my membership, teach people how to use their hands on their bodies. Once you learn block therapy, then you can start to use your hands more intuitively. And this is really exciting for me. I even have a hair health class. And I love this one because even gripping onto your hair and pulling the scalp away from the skull, not only does it improve hair health, but one of our members who happens to live in the UK, his name is Gary Sharp. He has a website called Outthinking Parkinson's, and he's been in my community for almost 2.5 years now. And he has changed dramatically in his posture. He's actually quite straight now. He's just lovely. But I put this hair health in about 3 months ago, and he's been doing it about 3 times a week. And he shared, not only is his bald spot getting less and his hair is getting better, but his neurological symptoms of Parkinson's are decreasing rapidly. So they were already decreasing, but that one class we added in has really been a game changer for him with his progress with all of this. So those are just some examples of how you can use this. And again, with that free gift that we're offering, you can dive in and try it for free just with a towel, and you're going to see what that does when you actually spend that time there. Was that enough of a demonstration?
Oh, that is absolutely perfect. Now, I know we're coming up to time because this is a bit of an intro and a taster for those who want to do the 9-day program. It's completely free of charge. Deanna has very kindly waived the fee on that. So I have put the link in, I've emailed it out as well. There are a couple of questions, so we'll do those 2 questions, but the plan is do the 9-day challenge, come back on the 30th, let us know your results, tell us how you've been feeling, what you've noticed, and we'll have a bit more time for Q&A as well. And you may also have some questions in terms of going through that process. So Deanna, we've got a couple of questions. Are you okay for time just to very quickly whiz through those? I'm great.
And on the 30th, I will not mess up the link.
No problem. It's all's well that ends well. We're all here. We're all good. So first question is, are there any contraindications of doing this?
There actually aren't. We have people starting in their 80s and 90s. We have some variations that would be necessary. For example, if somebody's pregnant, we don't do any of the work directly in the abdomen, but the rest of the body's fine. And for people that have really serious medical conditions, we do recommend that you work directly with one of our therapists so we can hold your hand for a little bit in the beginning. But again, not necessary, because it's so intuitive and safe, and again, it's really like you're the one doing the work on yourself, and people don't want to hurt themselves. Like that's not the nature, right? So people don't tend like, and again, it's not forceful, it's not fast, so there really aren't any contraindications. And we even have like 6-year-olds, 5-year-olds blocking. We're going to be doing our Block Therapy Academy for kids. We're going to be launching this in October. And again, yeah, you can be the elite athlete to the person that can't get out of bed, and you can access this work. It's the pace that changes depending on the level that you're at and where you're at.
Wonderful, thank you.
Can I just chip in? Can I chip in?
Yeah, go for it.
There's a pun here, because somebody's got a chipped bone, I think. But basically, I just wanted to say, as a user of the system, the diaphragmatic breathing, when Deanna showed there, when she was leaning on the block on her diaphragm, you start breathing, and it's really funny because we all think that you should pull your tummy in when you breathe in, but it's the complete opposite. When you breathe in properly with diaphragmatically, your tummy should go out like a balloon. You can almost look pregnant. When you breathe in, your tummy needs to go all the way out as far as you can get it to go. And when you breathe out, then your tummy should contract and become really small. And when you're lying on the block on your belly button, you should be able to feel your body lifting up, or on the block, and then diminishing into the block. And that's how you know that you're doing correct diaphragmatic breathing. So that, I think, Deanna, because you do it all the time, I'm just thinking of things that you didn't say that I think would be helpful for people. And the other thing is, when I spoke to Deanna for the first time and she saw me on the video, I was telling you about my eyesight, and I had an unfortunate medical negligence case that I lost my vision in my left eye. And Deanna said, "Oh yes, I can see the adhesions that you've got on your eyes, and you can do some block work on that." And I found that amazing. Number one, she could just suss me out completely, within seconds, to see where I had adhesions. But not only that, the thought of being able to improve the oxygen flow to my eyes and maybe make a difference to my vision. It's not all about weight, it's about, all sorts of medical issues. And Marilyn, I hope you don't mind me mentioning, but you would like to have your thyroid improved if possible, because of another issue that you had. And it's just not all about obvious physical things, it's about all sorts of things, even mental health. And that was what really blew my mind when I, the more I looked into this, the more I realized. So sorry, could we go on with the question? The second question Treena's written is, I cracked a bone in my back 2 years ago, Deanna. I'm now having difficulty walking and moving. Can block therapy help this?
If I can just share a quick example, I just did a fascia master, we're called fascia masters, that's the term I coined. We just did a discussion with one of my community members who is now in my teacher program. A year and a bit ago, she drove into a ice wall at 83 miles per hour on a sled. She broke 8 bones in 13 places. They didn't think she would get out of a wheelchair, and her left arm could not extend, and her wrist, she had 6 fractures in the wrist, a number in the elbow, and then of course she has plates all over the place in her leg as well as her hand. And she is almost back to complete full functioning. I spent 25 weeks with her. And again, this wasn't my hands on her. This was from a distance, guiding her on video as we were blocking, seeing where she was limited, and then giving her a daily program. And she was a rock star. I mean, she did the work, and yet you got to do the work. But she ran in 3 weeks ago to the EMT that helped her at the time of her accident. And he said, we had a bet you would never walk again. And she is walking without a limp. And she only has basically a little bit left to get this thumb back into action, but her wrist is functional. She can carry things. She can do up her bra, put on her earrings. So we're going to be sharing that discussion in about a month, but I am so excited. And we have the photos of the fractures. It was insane. So yes, absolutely. You can repair. And as I said on the interview as well, and even if the issue happened 20 years ago, you can still dive in, because this is all like, it's like if you think of taking an ice cube out of the freezer when it's 1 day old or 40 years old, either way, you put it into the heat and it's going to melt. And it's really about understanding that the system that we have is frozen. The necrotic tissue that they use implies dead tissue. I don't see that there's any dead tissue in a living body. There's only tissue blocked from life. And it's the adhesions that block it. And this is what block therapy addresses, is the adhesions in the fascia. So we can get rid of those, get that flow going, and resume. And if you do see my before pictures when I was in my 20s, I don't think, I don't think I'd be alive today if I hadn't found the system, because I was such a mess. But my face used to be so asymmetrical. I used to have nosebleeds as a kid on one side for years, every day. And I would literally hold my face this way, and like it created this contortion, and I had really, really thick jowls because I clenched so hard. And one eye was a very different size and shape. And not to mention the whole change in my physical body, but the changes that have happened over my life or over this process for me have been phenomenal. And I still have so much further to go. And that's what I love the most, is the progress never ends. You keep diving deeper. And if I can just mention this thing, because we talked about Greg Braden briefly, in the book, The God Code, he goes into the detail, but he basically shares that on the surface membrane of every single cell is the message encoded, God lies within. So when we're starting and we're literally frozen, I feel that the average person really has access to about 10 to 20% of their cell capacity, because that's about as much as we're probably breathing. As we start diving in and connecting to those cells that are deeper than what we're consciously aware of, then we start hearing our intuition, we start connecting to those deeper gifts, and we start creating that space in the body so that we can really understand what our true path is here on life, because we're very connected into the ego from the lack of breath. And Eckhart Tolle in The Power of Now talks about that, how diaphragmatic breathing connects us to God, it connects us to a certain brain pattern, and it's relaxing and it keeps us present in the moment. When we breathe through the muscles of the upper chest, it connects us to the ego, to the future and past where stress lives. And so most people are really caught in this drama cycle in their brain. When we can get past that, bring the breath down into the body and become present in the body, then we hear what our cells are saying, so that we can really view each moment as a unique moment and explore life from a very different perspective. And it's just such a game changer with how people live.
Well, that is amazing. I was just looking at the message from Magdalena. She says, this is phenomenal. Wow. Thank you. She also says, where can we get the blocks? I've emailed you the link, Magdalena, so check your email inbox. I'll put it into the chat as well, but I've emailed you the link if you wanted to get the blocks. But that 9-day program is a gift from Deanna, so there's nothing you need to pay to do that. But if you did want to get the blocks rather than your towel and the book, you can most certainly do that. And there was a question in here about the leg and the ankle, which we'll get to in a moment. But I just want to say, in terms of Dr. Margo, she said she's further ahead. My block arrived on Monday, which was perfect timing, really. So I'm on day 3 now. And I have to say, now, those of you who followed me for a while, I've been doing HUNA, H-U-N-A, for the last 20 odd years. I went to Hawaii to study in 2005. Those of you who've seen me do the HUNA ha breathing, where in through the nose, the stomach expands, exactly the same process. The only difference is the out breath is not through the mouth, making the ha sound. With block therapy, in through the nose, out through the nose. But the process I just described when we're doing the ha breathing is exactly the same. So you've got a head start there with regards to that one. And I found there's going to be what I call the pain barrier. And just at the point where I'd be going, oh my goodness, you would then say on the video, and breathe into it and remember to smile. And I would giggle to myself and go, oh yeah, smile, completely gone. But after that minute, it really does. It's almost like a switch just goes, and suddenly it's almost like I don't know, like a drop. The best, if you've never done pole fitness or pole dancing, you won't have any idea what I'm talking about. But there's a pole drop that you do, but you catch yourself just before you hit the ground. But it's that whoom. That's the best way I can describe it. But it has been amazing, really relaxing, very meditative. And by the end of it, what was painful, I don't know, you're actually then, like you said, because I was like, what is she talking about? Chasing the pain? I'm not looking for pain, but you are, because you're right. Oh, this feels, I've sunk into this now. What's next? What's next? What's next? And it's just been wonderful.
And what's important to understand is we're not causing or adding pain to your body. We're making you aware of the pain that lies within, deeper than what you're consciously aware of. So you can bring it to the surface, you can thank it and say goodbye. And then you dive deeper. And then the deeper you dive, the younger you become, the more space we have. Because again, it's all about keeping that space, and it's gravity over time that pulls us away. So when we put that time into the body and we bring our bodies back up and we become as tall as we're meant to be, then we're pulling those deeper adhesions, those traumas out of the body. So that again, like it really changes everything.
Can I call you back?
And the final question that we're going to do today, we'll have time for Q&A when we come back on the 30th. But the final question is, hold on, someone else says, thank you so much. This is just for this event. You're most welcome. So let's get back to this. So question was, how far can you go down the leg? They said they have ankle problems.
All the way. I have a number of classes in my membership, but also we get to the legs and the feet, but I've got 3 30-minute classes specifically just for the feet, 3 30-minute classes just for the legs or the calves, just for the knees, the thighs. I've got hundreds of hours, but more importantly, I have guided programs so that I've got a 21-day pelvis, legs, and feet program. We start at the foundation, we work our way up, and it not only is the blocking, but it also combines a 3 to 5 minute postural alignment training. So again, we can really bring that foundation back into play and strengthen it. So we release and we rebuild, we release and we rebuild, and we keep taking steps toward pulling those cells back. And I make it really, really simple so that all you have to do is follow along the days. And most classes or most days in those programs are 30 minutes plus a 3 to 5 minute strengthening alignment training. And if you can commit to that, you're going to see changes extremely quickly. But I have a 21-day women's health program. I have a 90-day challenge, which is really fun. We just did our we just finished our 21-day head, neck, and face program. And I just got the before and after photos yesterday, and we're going to be posting the blog on Saturday. The 3 top winners, I mean, this was 21 days and I was blown away with what they had done. Like it's not about just the skin, it's about the shape of the skull. Because if you notice what happens to people's skull over time is typically we start with a wider jaw and then over time we get compressed. So the face becomes more narrow and can often protrude. So you see this breadth coming back, which creates more room for the brain, more room for the eyes, for all the structures. And then for, most importantly, the carotid arteries here, the main arteries supplying everything up and through here. When we're sitting like this all the time, we're blocking the flow there. And that's also partly why we have to really understand the tongue and strengthen that as well, because if this muscle becomes weak, it puts pressure on the thyroid, it pulls the head forward, blocking those carotid arteries right through here, major lymphatic drainage sites. So for people that have issues with their skin, brain fog, or have had a concussion, for example, we don't want to go and pummel the head. We want to open up the rib cage to really open up that lymphatic drainage area so we can draw the garbage out of the body and then pump the oxygen and all the nutrients back up into there. So that naturally happens through just doing the work and the process. So yes, whatever it is, whether again, it's you've had health issues or you don't like how something looks or how you're aging or your size and shape, or trauma, because trauma gets stuck and stored in the fascia through the breathing mechanism. So now we can release how we experienced a negative event from years ago, and we can change our perception around it as well as our life going forward.
Absolutely wonderful. And that, everyone, is why that's just a little taster, tip of the iceberg as to why I was so excited about this and why I was so grateful to Dr. Margo for interrupting my schedule last week to pretty much badger me. I was like, what are you messaging me about this block for goodness sake? But thank you, Dr. Margo, for your usual persistence, because I don't know if you've ever got someone in your life that when they say to you, you should look at this, you actually go, all right, I don't drink, but people say, hold my beer. Give me a moment. I'm going to take a look at this. And Dr. Margo is one of those people. Everyone else, pretty much, I said, look, I'm not available. Have to wait until a week after next. But I was like, if Dr. Margo is badgering me about this, it must be something important and worth looking at. And for me, it definitely has been. So in terms of wrapping up, Dr. Margo, I'm going to come to you before we close with Deanna. But Dr. Margo, anything else you wanted to say or share?
Yeah. Thank you, guys. It's been great. And I hope I see from the comments that you guys are as enthusiastic as I was when I first heard it. You just can't, it's exciting because you think to yourself, wow, So all weight gain is not to do with what I'm eating. And you know, I could make a difference to my posture. I could reverse the aging process. And I even work out, you know, I train people sometimes, not so much now, but, you know, I'm a weightlifting teacher, and I've got my own gym in my home in Spain. And basically I was thinking, this isn't making any difference to me. My muscles aren't getting any stronger. Maybe my body's just got used to it. But, you know, Deanna works with her nephew Quinn, and he's a bodybuilder, isn't he, Deanna?
He was a physique bodybuilder. And yeah, he's very much changed his process, but yes, he's on all the videos. You'll see him. He's beautiful.
Yeah. And he's, you know, I've seen him when he was young at the beginning. It was amazing. But what I realized was I need to get the fundamental core stuff ready and worked on before I can improve my muscles through the lifting weights. I realized that. And the other thing is, I think it's deceptive, because you think to yourself, well, that's just a little bamboo block, and Deanna's just lying on her tummy and she's holding it for 3 minutes breathing, you know. And honestly, guys, when you go into these programs, when you go through even the 9-day starter program, there was a class at the end that was 2 hours, and I was calling Deanna names by the end of it in my head, because I was like, you're kidding, do I have to do that, you know? So it gets harder. It's not a piece of cake. It looks so simple, but it's incredibly deceptive in how effective it is. And the other thing is the pain, like you guys said, you know, you just keep going towards the pain, and it's quite a nice feeling in a way, some ways. I think we're so used to such an easy life that we just avoid pain, and it's good for us to address things. So thank you so very much for doing this, and we're really looking forward to the 30th when you're coming back to talk to us.
Well, thank you so much, everyone, for taking the time and listening. And I'm super excited to be back. My purpose and mission is to just teach people to become your own healthcare advocate. We know the most about our bodies because we live in them. And when we give that power to someone else, you're not going to get that same understanding of what you need. And to just know that you actually can change things on your own, it's so empowering. And then that translates into life as well. When you learn how to breathe through pain, you learn externally how to breathe through stressful situations. And again, it kind of translates into life as well. So I'm just so excited that you're all here, and looking forward to coming back again on the 30th.
Wonderful. Thank you everyone for showing up. I can see lots of smiling faces on here for those who have your cameras on, so I'm going to take that as a good sign. There are some wonderful comments in here as well. Someone else says this introduction is perfect timing. Thank you, Dr. Margo and Marilyn, for introducing us to Deanna. Kate, you're most welcome. Someone else says it explains weight and trauma and the relationship, physical, not just psychological. And other people are just saying thank you so much. So thank you, Deanna, for creating this wonderful product, for your time, for your generosity in bringing this to the world and bringing some of that to us today. Thank you again, Dr. Margo. If you did come in a bit later, don't worry about it. We have been recording this, so you can watch the recording, catch up with anything that you missed, and we hope to see you again on Monday the 30th, same time, 6 p.m. UK BST. And that's midday Central Time if you're looking in the United States. And if there's anyone you know who could benefit from this, then please feel free, when you have the link, send it to them as well. Because like Deanna, I'm just really excited for people to feel, as Margo was saying, to be more almost in control and more in connection and communication with your own body, so that you don't just feel like things are happening around you. So thank you all, really excited.
Thanks a million, guys.
Days.
Thank you,
Lovely
everyone.
to see you. Bye.
Bye-bye.
Bye.